herpes virus. There's one type, 1 and 2. The one is not really a sexually transmitted disease. It is like the cold sore you see on your mouth when you get your immune system is weakened. You catch a cold and you see that. It is a type, but that is not the sexually transmitted one. HSV2, that is the one. So I asked the doctor in the clinic, I said, so how could we know the difference? Because in Trinidad, we can't afford to have these expensive tests done to identify which type. He said, well, we really don't know, but the sexually transmitted one, it erupts more often because it comes up as blisters. It's like little water bladders. It might be a few in the area of contact, and that liquid, that or whatever, do not use your bare hands. Use a swab or put on gloves because you could infect other parts of your body. That is how infectious. And then some people are so brave. As we counsel people, and you hear them saying, who is your partner's name? Who, you know the name of your partner. And you're supposed to, we have some people called contact tracers. Because these diseases that can be cured, you need to get the partners tested and treated. All right? Once they come to the clinic and they are positive, they are given slips to carry for their partner or partners. And many times it's partners. And they're supposed to come in for treatment. If they don't, they go and get them wherever they are. A contact tracer told me he went by this house and he was calling, good morning. Because if they don't come, they come for you. Good morning, and you say, no, they're home. He said, I come from Queen's Park Counseling, and he test positive. He said, that is not good at all. That is not what. He said, but I know she there, and she not to come inside do it, and she fly outside. Because now this is something, you don't want your neighbors hear that. I watched him, I said, you did that? That is not ethical at all. You know, but this is the type of things people do. He said he had to give her it, and he had to try something, so he did that. That wasn't right. I told him that. He knows it wasn't right. But that is what happens. Once they send the notice on his boss' computer in his work. I don't know how they do these things, but they do it. Right, so these, when they come up, you just have to treat whatever symptom and wait, and they'll try until it will keep yourself as healthy as you could. But whenever your immunity is weakened, say, it will flare up again. Flare up. They're very painful. And it could be anywhere, wherever it goes, wherever it got in, or where you touch. If you sit down in your nice short pants in the maxi, and somebody had it, and the liquid or the juice, let me use it as a children like to say, the juice. And the juice go on the seat, and you're in your nice short skirt or your short pants, and you sit down, and the juice touch your skin. You are going to get infected. So please, be careful. Cover up yourself. All right. So we are going to talk about the HIV, which is the big one. Everybody used to finance it long time. Everything HIV. Now you're hearing anything about HIV? You think HIV gone away? No, they have spent so much money on it, and they realize it's still there. Nobody is financing it again. Now people don't die like long time. When you think about HIV, you think about a coffin and a skeleton, right? Yes, because they didn't have any antiretrovirals. That is the treatment. That is the medicine you give them, right? And they see the count rises, the viral load goes down, and the bad thing is that some people get a negative reading for HIV. When it goes too low, it is undetected, and that is frightening. You understand? So people put on their guards now. They're not afraid so much of it. But it will not last forever. Your body will not be able to be subjected to this type of medication, this cocktail they give you, for too long. So in 10 or 20 years, the person will still die. There's a window period for people who want to remarry. Be careful. You want to get remarried because your wife died. Do not just say, well, I will just go with this partner. I love her. She looks clean and nice. You have to have them adequately tested. Okay? A lady whose husband left her, I went to work in Cora, and the lady was naked, running all over the savannah, and the men with sheet and gloves running, the attendants trying to hold her. What? An Adventist woman. Husband left her. And the pastor said, oh, my sister, oh, God has sent him back for you. So welcome your husband. Welcome with open arms. She used legs too, open arms and legs. She contracted it, and she died before him. The frustration, her mind, she couldn't take it. It was a sad state. We have to be wise people. Let people be adequately tested. The first test you do shows how you were 6 months before. So if you get negative, you do it today. You know that 6 months before today, you were negative. But what happened last week if you got it? So you must continue testing. Make the person test. Please be careful. I have seen in our church, we have people come in and people didn't test and all that, and they contracted all sorts of diseases. We have to. And we can't just judge, make decisions on how we think. We have to ask for divine guidance. Is God have to really direct us, you know? Okay? And I thank God for the way he guided me. Because I got a divorce, and I have lived alone, but haven't placed me in QPCC where I quarreled when they put me. Because I had done my DH3 course. I'm a district health visitor too. And they put me there, and I would get no more traveling because that's a government post. But that made me see people, real people, people coming in and lying. A man came, he brought his wife and told her he drank hot coconut water. And she came smiling for treatment. She said he drank hot coconut water. She didn't know. And we can't tell her anything. That is what I see. And that is one that helped. Apart from God directing me, I got the evidence. I got to see how people could be. I don't think Adventist people weren't there. And when they come, I have to interview them. They know me good. I have to talk to them and keep a straight face. So, brethren, we are living in a time when there are all sorts of diseases. We do not know who is sick. We have to just pray and ask God. Sexual activity can continue, I tell you, in old age. Please, if you have your wife, husband, stay with your husband. And do not rob your husband, right? Although you might have little problems, there are things you could do to make sure that you all could enjoy your sex life. And don't get fed up during menopause. Women have little problems. Men work through it with your wife. Don't say, you see you get cold, me able with you. And you start going to look for what? Sickness? No, this is your wife for the rest of your life. So that's what I will say. Let us try to live a healthy sexual life so that when God comes, we'll go to heaven happy without these strange diseases. Thank you. Any questions? Yes, there.
Yes, you spoke in your opening of your presentation concerning menopause.
Yeah.
Because we're dealing with SDIs. And then you closed it again with menopause.
Yeah.
To me, it's not something that is spoken widely within the church so that husbands and wives can understand, especially husbands understanding the process of menopause and what happens so that a wife may not be able to
Yeah.
operate in the way that she's supposed to operate. And sometimes STD comes into the family because, the hormones going all over the place.
Right.
The wife seems like she's going crazy, but the husband doesn't understand what the wife is going through, and therefore, someone on the outside comes in and,
Yeah.
treats him
Better. We Venezuelans.
it would be nice also.
Yeah, so them.
Men go through when they are reached at their peak. So if it is, you can actually just bring a little bit more. I don't know if you have the time.
No, I don't have the time. But this morning, incidentally, that's what I did in Aruka Church. Menopause. Focus was on that. Yeah. But it is a topic that is lengthy. It has many aspects to it, so we won't be able to squeeze it in a minute. You know, but men, I spoke to men a lot today because they have to understand. They have to, you love your wife, you love her all the time. Why now if she's going through problems? As I told them today, I said, God cursed man and say you will get trouble to eat bread, right? And he said he'll give, women will have pain to make the children, he cursed them that way. But from the time period of menstruation starts, menarche, women have been having problems, even these young girls, the amount of pain and vomiting and all this. And then you have your babies, you have any pain, and then you reach menopause, you have all this mood swings, and everything has changed. The hormone is fluctuating, and everything is... And then the men don't have all this thing, and before they just be kind to their wife. Just be kind. Just be loving. The vagina is not as lubricant as it used, you know. It's dry. Oh, goodness. You'll say, oh, God, how you get so good? No, or you will hurt your wife. There are things you go, if you don't know for yourself, you go on Google, you go to the doctor, and just be kind. And that's your wife. Continue with your wife. Okay? And not go into middle behavior we see at middle-age crisis. These men, how they're going looking for little girls. Right? No, that wouldn't work. We are Christians. Oh my, Jesus is going to come. You know? And we don't want to be left out. Why? Because we have to say, Lord, I'm sorry you gave me a sex organ. I couldn't control it. Okay? Thank you. Oh, one more question here.
If there are people, okay, maybe mature adults in church who want to get married, and they see partners, to what extent, or could you just guide as to what are some of the things that both of them must do? Because I'm hearing you, and you said their former life might have been tied up with different diseases and so on. No, they may not tell the truth, but it is a serious risk to innocently plan to get married to somebody who is now in the church and you believe that they're nice and clean. This is very scary.
It's scary.
Just share, you know, what both of them need to do, because one can be should not be shortchanging the other.
If the person has a viral sexually transmitted disease which erupts now and then, they live without any infection for a while, you don't see it, right? They don't see a disease sometimes. So even if you go, you know, the tests to do these sort of viral, very expensive. We don't really do it. They depend on history taken. These sores come up and they go or whatever. So there are some things will get away. But there are some tests available here in Trinidad, right? We can go and do an examination, both go and they can do tests for the gonorrhea, for syphilis, for HIV, and all these things. But there's a window period I was telling you where it won't show up. So you must go. I will say for about, I used to think it's only 6 months, but we get to realize we had a patient whose husband died and it took her 2 years before she seroconverted. That is where the antibodies show up. Now they never tell people that, because if people start going to test, oh my, if people going every time to test, they won't be able to keep up with the people, so they tell them 6 months. But for me, I believe in the 2-year testing. I don't know if they could wait so long, or if they can't wait and they just want to get married, they will have to know to have the guards on and protection and all of that. But they cannot think that the person, as for the gonorrhea, getting results and think one time. As for the other STDs, like a man, he had like me. Now, as I told you all, I haven't any sign on my back. Mark, I needed, man needed. But somehow men must say, well, you know, she was a nurse, she had a house, she must, right? But the person's wife died with cervical cancer. What I told you all, what causes cervical cancer? Right. I work in a clinic. Could I tell a man that? I wouldn't tell him. But deep in my mind, I know this is a threat for any woman going with that person, because that man's supposed to have that. Because that is over 90% of cervical cancer caused from that, from HPV. So this is what happens. Now I know the history, and I know somebody else don't know. They happily get married, and he got married. So we have to pray. Everybody must pray. If you get married, you're not sure, well, it's only prayer and God, right? When I pray and God tell me, you are good, just so. I'm a happy, single woman praising my God. And I wish many women could be happy and single. But the thing is, many women cannot see themselves complete without that man, without that ring on the finger. You know? But when things not good, you just want to get rid of the ring. I remember saying that thing. I took off my wedding ring and say, no sense you have a ring and you don't have a man. Off the ring went. Right? Any other question? What STDs?
There are so many things that women are sick with. What do men suffer from?
Their main thing at the end of the period is prostate. They suffer with their prostate. It's a slow, insidious growth. You're going to have that for over 30 years, prostate cancer or a tumor. And the only problem mostly you will get before is where the urine is getting problems to come out. You know? If there's problem to pass urine because it's pressing. The prostate gland is sort of blocking the passage. And they'll put a catheter. I'm sure you all know about that. You see men with this bag by the hospital with the urine draining. Or they'll do surgery. But sometimes they don't even worry to do the surgery. Yeah. So that is the main thing men have. And that comes on mostly after they live a long life. But as women, we have things right through, right through. Anything else, or that's it? You all have a next speaker? She's here? Okay. Well, it was nice being here. I wouldn't be staying because I have to drive away by myself back up. I don't like to drive in the night. So I have some handouts I would leave for you all so that you can read up on some of these things. I didn't go right through and get to go into because I just wanted to go a little wide so that you all could understand the importance of being safe. Right? You're welcome.
Testing. Oh, Sister Archer, thank you so much for taking time on your Sabbath in the rain to come and so eloquently bring across the SDIs. And yet still, it was very forceful and it educated. I bet some of us, or even most of us, we learned something new today, at least one thing new today. And not because we are a certain age, that means, you know, that we are immune. Yeah? So thank you very much for keeping it real. Yes? And this is a very small token of our appreciation.
Thank you.
Yes? So thank you very much again.
Thank you very much.
You're welcome.
When you miss me, I'm
Okay. So in Trinidad parlance, without sticking, let's move on to our next speaker. And her name is Dr. Kia Clement Marshall. And she's a medical doctor, originally from Point Fortin. She graduated from the University of the West Indies with her Bachelor of Medicine and Surgery degree, and further completed her postgraduate qualifications in occupational medicine in the United Kingdom. She currently works as an occupational health physician, managing the health of the workforce for companies. She chose this field because of her great love for interacting with persons from all backgrounds and educating them on preventing the occurrence of diseases, encouraging healthy lifestyles, and encouraging healthy lifestyles. Her love of interaction and educating others also extends into her personal life, where she spends a lot of her time doing non-profit work in schools, churches, and communities, giving lectures, free medical care, and advice. She's married to her husband of almost 4 years, Jerome Marshall, who is a great support, always encouraging in her endeavors, academically and otherwise. She's a member of the Marabella Seventh-day Adventist Church, where she serves as youth teacher, health ministries personnel, and community services board member. When not at work or church, she often can be found lost in a good book, trying a new recipe, doing an outdoor activity such as hiking. She enjoys empowering persons, especially women, to embrace and elevate their health. She considers herself to be very approachable, open to questions and enlightening discussions. As a result, she is here with us today to discuss womanhood. Sorry, men, but still, you have wives, you have sisters, right? Why did God think making me was a good idea? So without any further ado, let's present Dr. Kia Clement Marshall.
Good afternoon, everyone. It is so nice to be here. I think this may be my first time here. Yes, thank you very much. I must apologize for my voice. I came down with the flu this week and my voice just went, but I was really excited about being here. So I hope that you all would bear with me. Now, usually when I do presentations, I tend to do it more interactive. I don't like to just, be the one talking. So we will be discussing this afternoon. Normally, I do purely health-related discussions, but this afternoon I was given the topic, why did God think making me was a good idea? And to be very honest with you, in preparing it, I kind of ministered to myself as well, because there were some things that I never thought about, some things I never appreciated about being a woman, that I'm hoping you all would find empowering this afternoon as well. Yes? Okay. So, are you all seeing? No. Yes, okay. Women of different shades of brown, different ages, right? Why did God think making me was a good idea? Now, Psalm 119:73 says, your hands have made and fashioned me. But I just want to hear from you all. When you think about, thank you. When you think about why did God think making me was a good idea, what comes to mind? Does anything come to mind? Purpose. When you say purpose, what do you mean? So there had to be a reason for God wanting you, and I agree, but what is that reason? To model him. Good. Good. Anybody else? When you think about why God made woman, what do you think about? A helpmate for man, right? A companion, okay. And to be very honest, when I initially started thinking about it as well, the normal things came to mind. A helpmate as a companion, somebody who is willing, who is able and has the ability to give birth, that kind of thing. Those are the things that we tend to think about, right? But some other things that came up the ability to create life, and the reason why I phrase it as the ability to create life is not just for the birth aspect of it, but from the aspect of, if you think about it, women, if we decided that the earth is going to end, the earth could end. If we had no more children, if women decided we are not going to have any children, what would happen to the world? When I say the world would end, as in the population density is going to decrease drastically. So when you think about it in terms of that, we have the ability to create and influence, right? And actually, my husband was the one who drew this point to me. He said, he asked me if I ever wondered why Satan attacked Eve, right? And I was like, well, probably he knew that he might have had more influence on her. But he said, but what about the fact that Eve had something that Satan didn't have? Eve was the only one, between Adam and Eve, she was the one who had the ability to create. And Satan didn't have that, right? Adam didn't have that. Eve was the only one who had that. And we as women are the only ones who have that, the ability to create, right? We are able to inspire people around us and influence people around us, because if we grow up a child with a certain mindset, that's the mindset that the child is going to continue, right? If we decided that we are going to be angry and upset and contentious all the time, the people around us will be the same way, right? So we have a lot of influence. Another thing, somebody mentioned a helpmeet. What do you mean by a helpmeet? I know, but what does it mean to you? Because we're talking, right? Mm-hmm. Mm-hmm. Okay. So he made Eve a companion for Adam, of which I completely agree. So we were made to be companions with men, right? And I think this applies to the church as well, because when we think about it, we as women as well as men were made in God's image, right? Which means that we must be reflective of him as well. But when we look at women and men, we are so different that I think we represent different aspects of God's personality, right? The men, not saying that all men are like this, of course, and all women are like this. It's not that general. But the fact is that women tend to display more of the nurturing, healing side of God, right? Generally, right? And the men reflect other areas. But just to throw it out there, can a woman who is not married be a helpmeet? How? You all heard what he said? He said that a woman can basically embrace and bring up children who are not hers. But is that being a helpmeet? Okay. Okay. Interesting. That's a whole other discussion, though. Interesting point. I heard somebody on this side was saying something. No? Okay. So when I thought about it, I was thinking about it as a helpmeet within the church. Now, the same way women have different qualities than men, is the same way those qualities are going to be incorporated into the church. Like, for example, I am a firm believer, and many studies have shown that women have a higher level of emotional intelligence, right? A woman will be able to pick up on somebody's feelings and emotions way faster than a man may be able to do that, right? And in that way, within the church, women have different roles, if you understand what I mean. Yeah? Okay. Now, women in leadership, can we lead? Yes? We could lead, right? And when we think about ourselves as women, a lot of times we also think of ourselves as docile or meek, right? But can somebody who is docile and meek make a good leader? Somebody who is docile and meek can make a good leader as well, right? So having those qualities is also an important part of leadership. If we think about some of our bosses, if they're very intimidating and strong and unapproachable, then that doesn't necessarily make them a good leader. But we feel drawn to the compassionate leader. We feel drawn to the empathetic leader, right? Which represents a lot of the qualities that women have. If we think about some of the female leaders in the Bible, the women who come to mind would be like Miriam or Deborah. These people were women who also displayed good leadership characteristics, right? Now, you all could correct me, but as women, do you think that we tend to be hard on ourselves? Yes? I feel like we tend to be overly critical of ourselves. Somehow we always put ourselves last, or we always think of ourselves negatively. And you know, it could be kind of depressing, you know, the way we think about ourselves. So the thing is that God gave us great qualities, right? God gave us great minds, great physical bodies, but the reality is that we have to take care of ourselves, and we often tend to put ourselves last. So I just want to go through quickly some of the things that we can do as women to uplift ourselves. So number one, speak good things about yourself, right? Declare what God's word says about you. For example, you say, I am righteous. I am righteous of God in Christ. I am made acceptable and beloved. God loves me. He formed me with his own hand. And God doesn't make mistakes. So intermittently, we have to take time to, you know, just sit down and reflect and think, God made me like this, right? And he doesn't make mistakes. Everything that he makes is perfect. So I am perfect, right? We have to speak good things about ourselves. We have to avoid comparing ourselves with other women. Now, this is a big one, right? Because it is so easy for us to compare. Physical achievements, so many things, right? And it slips out so easily. Sometimes we may not even realize that we're comparing ourselves, right? But we have to avoid comparing ourselves. God made all of us in so many varieties, so it means that he has to like variety. Or else all of us would look the same, we would have the same personalities, we would have the same strengths, right? But we all have different strengths. And the thing is that we can't look at other people and want to exemplify some things about them. Or you might see somebody who is a little stronger in an aspect than you are and you want to grow, right? But it's important not to compare to say, well, I am less than because of. You want to compare. If you have to compare, and I use that word very loosely, you want to say, oh, I would like to grow in this area to better me. Yeah, understand the difference? Yes? Okay. Focus on your potential instead of your limitations. Now, when we think about it, sometimes we see persons who are very confident, or they seem like they have everything. And when you think about it, or when you look at it, that these persons with that level of confidence, they have weaknesses too, you know. They have weaknesses as well, but they don't display that, or they don't harp on those. They harp on their strengths. So we want to concentrate on our potential and not our limitations. Learn to cope with criticism, which is very hard. It is very hard. And as I said, a lot of times criticism comes from ourselves. Criticism might come from other persons. It should not come from your partner, but sometimes it can, right? And we have to learn how to cope with this. Now, when you know that you are perfect and complete in Christ, then you start believing that you are not lacking or you are not less of. And when you start thinking like this, you realize that you're able to identify what criticism is helpful and what criticism is not, right? So we learn to cope with criticism. And our major point is to take care of our health. Now, as I mentioned before, we tend to put everybody above ourselves and we don't take care of our health. When was the last time we went to the doctor? And not go by the doctor when things real bad, but go by the doctor to ensure that things don't get bad. When was the last time we did that? Anybody? We don't do that regularly, yeah? We tend to do it when we are dragging, right? And as women, especially, when a woman in the house is ill, what happened? Things fall apart. I don't know why, things tend to just completely fall apart when the woman of the house is ill, right? It's really important for us to take care of our health. Now, I want to just touch on some of the things that are important for women, as in women's health in particular. Now, it's not to be negative or anything like that, but the reality is that there are certain things that affect women that don't affect men, right? And when we can enlighten ourselves and gain knowledge about these things, we're able to take care of it, and therefore we're able to be the best woman that we were created to be, right? So we'll move on quickly. One of the big things, have we ever heard about fibroids? What is fibroids? What is fibroids? It's a growth, right? So this is a picture here of the female reproductive system, just for us to understand what we're talking about, right? So this is, actually, I should have done it as a quiz. Let's do it as a quiz. What is number 1? I don't want to hear from you. So number 1 is the vagina. What is number 2? Everybody seeing clearly? Yes? The cervix. Did she tell you? No? Okay, good. What is number 3? Oh, no, she can't say it. Number 3. I want to hear from this side. This side is so quiet. What is number 3? Do we know? Okay, so number 3 is your uterine wall, right? Number 4. Number 4, no. Number 4 is your uterine cavity, so this is where the baby grows. Number 5, fallopian tubes, excellent. Number 6, that one might be a little difficult. So I'll tell you, that is your fimbria. So when your ovary releases the egg, that is what kind of catches it. Number 7, the ovary. And number 8 is your endometrial lining. Excellent. So just for us to understand quickly, fibroids are, as my sister said in front here, it's a growth, right? A growth that could take many different sizes, as we can see. Now, fibroids are very popular, very common in our population, right? In particular, because we are Afro-Caribbean women. In Afro-Caribbean women, there's a 1 in 2 to 1 in 3 chance of you getting a fibroid. So if there are 20 women in here, just on average, about 7 to 10 of us would have fibroids in here. That's just to tell you how popular it is, right? And you have different areas of growth. As per this picture, it can grow in the womb, around the womb, and that will cause a variety of symptoms. So What are some of the symptoms? Anybody knows? Irregular periods. Heavy bleeding, excellent. That's one of the main ones with fibroids, heavy bleeding. So there are some women who get very, very, very heavy bleeding, or sometimes bleeding with clots, and they might say, that's how my period always has been. No, that's abnormal. So if you're having that, it needs to be investigated, right? Heavy bleeding. I heard somebody say something. Pain. So some women can get pain, yes, depending on where the fibroid is. If it's pressing on a nerve, it's pressing into your back, that kind of thing, right? Now, this is where the uterus is. Sorry, there's a pointer here. This is where the uterus is, right? And your bladder is just in front and your rectum is behind. So that's just to give you an idea of the configuration. So based on that, what are some of the other symptoms? So if your bladder is in front, your rectum is behind, and you have this mass, which is non-cancerous, by the way, and fibroids don't become cancer. They always remain non-cancerous, right? So that is one relief. What is something that could happen if your bladder is in front, rectum is behind? And what symptoms would that cause? You were saying something. Huh? Anybody? It could, but before it gets to there, if it's pressing on your bladder, you'll be going to the bathroom very often, right? So you'll have frequent urination. And if it's pressing in the back, where the stool is passing, constipation. So those are two popular symptoms as well. So just to go through quickly the general symptoms: heavy bleeding, irregular periods, so bleeding between your periods, lower back pain sometimes, pain during sex, frequent urination, constipation. Sometimes your belly just feels very full. You can't explain it, but you have a general fullness. That is a common symptom as well. And pregnancy complications, if it is that you tend to have a fibroid within the womb. Because if you think about it, if it's within the womb, there is no room for a baby to grow, right? So you tend to have difficulty with pregnancy. Now, this is just to give you an idea as to the possible size of a fibroid. Just by the way, the tiny one you see in there, that is actually the womb, and the big one is the fibroid. Yeah? It could get that big. The biggest I have seen was the size of a basketball. That's the biggest I've seen. Yeah? So, I'm just going to stop here just to find out if anybody has any questions on fibroids before we move on quickly to another topic. Yes? What causes fibroids? Good question. Now, the cause is not really known. The cause is not known, but because it tends to be more popular among Afro-Caribbean women, it's thought to be environmental and genetic somehow. But we don't have a definite cause for it. You mean when you enter menopause?
Yeah, I've heard it said also that when your period stops, the fibroid shrinks because the fiber is actually feeding on the blood. Is that true?
Right, so the fibroid feeds on blood supply to the uterus, yeah? But your fibroids don't shrink until you enter menopause. Because during menopause, your estrogen levels drop, and estrogen also feeds the growth of the fibroids. So your fibroids don't really shrink within your reproductive years, but after, when you enter menopause, yes, they shrink at that point. Right, which is a good question. Unfortunately, there is no preventative soundproof method, if you understand what I mean. As in, the healthier your body is, yes, you tend to be in a general healthy state. However, fibroids is not something that your diet could control completely. And the other side of things is that right now, our foods have so many chemicals and hormones in them that it tends to affect it anyway. Now, as I said, your diet can help in overall health, but I can't tell you if you have a vegan diet, you wouldn't get fibroids. It doesn't work like that. It doesn't work like that. Yeah?
What I want to find out, now, if your body doesn't be active, right? Listen to what I'm saying. If your body doesn't be active, or if you sit down so long, right? And when you get up, or if your body don't get active, is it your body going to break down, or if you cannot get up? Huh? Is it your body going to break down, or if you cannot get up, if you cannot do anything? All right, let me ask another question. Now,
You mean
yeah.
as if you have an inactive
Yes, yes, yes.
Okay, so his question basically is if you have a sedentary lifestyle, if that can lead to you getting fibroids. And no, it doesn't work like that either. It doesn't work like that either. Because as I said, it's partly genetic, partly environmental. So you could do whatever and it would still, it could still occur. So no, it's not related to that aspect of your lifestyle.
You said that fibroids don't ever turn cancerous. But I know of at least one person who she had, and they moved the thing and tested, and the next thing is you hear cancer of the womb. So what it is what cause?
Yeah. So you can get cancer in your uterus, but it's not due to a fibroid, right? So uterine cancer can develop. It's not one of the more popular types, but just like how cancer could develop in your breast, cancer could develop in your uterus. And cancer is due to a change in your normal cells, right? Which could occur in any cells in any way in your body. So when I said that fibroids are non-cancerous, what I mean is that some persons think that once they get a fibroid, if it stays too long, it would become cancer. And that's not the case. It's a non-cancerous muscular mass. Yeah? Oh, sorry, I forgot you had a question. No? Oh, okay. Yes. All right, so I'll just move on quickly to the other topic. And I know you had some questions on menopause, so I hope that I'll be able to answer some of those for you at the end. Yeah? Okay, so this one should be a quick one, but the reason why I put this in is because I think we don't talk about it enough. Has anyone heard this term, endometriosis? Yes, what do we know about it? Most times when I ask that question, people hear about it, but they're not sure what it is. Yeah? Okay, so endometriosis is also a condition in the womb. Basically, to summarize things, remember on the initial picture, I showed you the lining of the womb, right? Now, when a woman gets a period, how it works is that your ovary would release an egg, right? Then if it is that the egg is fertilized, it goes on to form a baby. Now, when your body is preparing to receive a baby or to receive the fertilized egg, the uterine lining gets very thick. But when the egg isn't fertilized, then the womb realizes, okay, no baby this month, let's get rid of this lining. And that shedding of the lining is what gives you a period, right? Now, with endometriosis, the lining that is in the uterus could actually be found other places of the body. So sometimes you have it outside the uterus, around the tubes. Some persons have it on their liver. The furthest place I've heard it being found is in your brain, right? And when you get your regular monthly cycle, the same way your uterine lining responds, the other tissue in other parts of your body respond the same way, right? So you tend to have a lot of shedding. And if you think about it, the lining of the uterus has somewhere to pass. It comes through the shedding comes through your vagina. But if it's around in your abdomen, where does it go? It goes into your peritoneum, which is the fancy way to say it just goes in your belly and it settles and causes irritation, right? So if you think about it, what do you think would be the main concern or the main symptom in someone with endometriosis? Pain. Pain. That is the main symptom. Have you ever heard of, or do you know anybody who during the period is so painful, they're vomiting, they're fainting, right? And you'll hear people say, oh, she's just have real bad periods. No, that is not normal. And a lot of the young women who have had periods like these, recently through investigation has been found that they have endometriosis, right? And so if it is that you know somebody who experiences that, let them know that it's not normal and should be investigated, right? So basically, that is what endometriosis is. Now, in terms of treatment, because of how painful it is, the main treatment is to treat the pain, because these women get pain sometimes. It depends on the stage, because there are 4 stages, stage 1 to 4. So, of course, stage 1 would be less pain, and stage 4 is intense, right? Some of them, depending on the stage as well, infertility is another big problem, right? So the earlier you catch it, the better, because it could progressively get worse as the years go on. So you treat the pain, you treat the symptoms basically. If they are tested and it's found that they have infertility due to it, then they treat it accordingly. But the main thing to be aware of is that extreme painful periods are not normal. I think growing up, you know, at least for me, everybody would just say, you know, this one just has really bad periods, you know. And as I got older, I realized that that is not normal, right? So basically, that is what endometriosis is. Any questions on endometriosis? Yes? No? Okay. Yeah? All right. And I am going to close off now with menopause. Right? Now, when women put men on pause, what is the men that we're thinking about? Who men? Your spouses? No, that's not the men. That's not the men we put on pause. Which men we put on pause? Your menses. That's the menses you're putting on pause. So you're not putting the men on pause. You're putting the menses on pause, right? And when we think about menopause, this is what we tend to think about. Somebody who just always hot and sweating. Yeah? At least that's what I thought it was until I learned better. So what is menopause? What is menopause? Somebody said hell on earth. That's unfortunate, but she's not the first person I've heard describe it like that. So menopause is essentially when your period ends, right? When your period stops. So the word mens came from the original word meaning monthly, and pauses means cessation or stoppage. So stoppage of your period, right? Now, unfortunately, menopause could be a bit difficult. And as I said, I actually wasn't planning to touch on it, but because you had questions about it earlier, I said I would just mention it briefly. So just for us to understand, during menopause, the estrogen levels drop drastically, and that accounts for a lot of the physical and psychological concerns that women have around this time. Right, so this is just to give you a picture idea. At 35 years old, your estrogen is at its peak, right? And then after that, it starts to drop. Now, normal menopause occurs between the ages of, between the ages of 48 and 55 usually. Some persons get it a little earlier, like 45 and above, right? However, if it is that you have menopause under 40, that is not really normal. A good indicator as to when you would experience menopause, though, would be when your mother and your grandmother experienced it. So if they had it around 50 years old, most likely you would have it around there. If they had it around 45, most likely you would have it around there. So it's just to get a general gauge, right? Now, how do you know that you're menopausal? So you have physical and psychological symptoms, right? Now, with the physical, yes, your periods will become less. You get hot flushes, right? Which I've been told by women who have it that it is not just, ooh, the place making hot. It's not that. It's an internal kind of burning furnace sensation that feels all-consuming, right? So it is a little more difficult than what we may think it is. Some persons get night sweats, some persons feel their heart is racing, some persons have a decreased sex drive. Now notice I didn't say no sex drive. I said a decreased sex drive, right? Now the good thing is that most women would not get all of these. Some women get all, some women get none. Lucky for those who get none, but some persons will get a few, right? The psychological ones, which are the ones that, from my understanding, the men tend to have a problem with, right? You can correct me if I'm wrong, but the mood swings, irritability, increased anxiety, changes in your sleep pattern, difficulty concentrating, forgetfulness. And I think this is really important for us to understand because as men and as children with mothers, you know, we may not understand what they're going through during this time. But when we could educate ourselves on it, we realize that we're able to be a little more empathetic and understanding and try and help her through it, right? And it's also important for the woman to communicate how you feel so that your family members could understand and help you through this time, right? So how do we manage it? How do we manage menopause? Any suggestions on how we're managing it? Your diet. Now, menopause, your diet actually plays a pretty big role with this because the healthier your body is, the less variations your hormones tend to go through. And that up and down of the hormones is what kind of makes you get these psychological symptoms, yeah? So the diet that you want to take would be things that are not as high in fat, things that are not as high in cholesterol, foods that are heart healthy, things with iron, your vegetables. You know, you're not saying that you can't have any butter and cheese and thing, but you want to decrease the frequency and the amount that you use, yeah? Those things help. What else? What else? Do you take time for yourself? If you enjoy going on a walk, do you go on a walk? Yes, exercise. So it keeps your body feeling healthier, so you're better able to deal with things. Exercise plays an important role. What do you do to relax? You know, I asked somebody this at church probably 2 weeks ago, and she said to me, "Girl, I can't remember the last time I relaxed." What do you do to relax as a woman? Read a book. What? Gardening. What else you do to relax? Do you find time to relax every day? You do? If you do, that is excellent. That is excellent because the reality is that nobody could deal with this for you. Nobody could take care of you for you, right? And so you have to take time, even if it's 15 minutes, to just lie down and do nothing. You know, 15 minutes just to yourself to relax makes a big difference in your overall health. Now, as I close, what, sorry? Question? Oh, sure.
I'm so sorry, I was to ask this question before you started there. Is there something called tubal pregnancy, and what causes it?
So there is something called tubal pregnancy. It's called an ectopic pregnancy, and that occurs when, when you have a fertilized egg, right, it's supposed to go into the uterus and implant there, right? But in some persons, the sperm kind of meets the egg and fertilizes it in the tubes. And therefore, the baby starts to grow in the tube, growing like if, they're in the womb. And of course, as you could imagine, the tube cannot hold, it doesn't have that amount of space for growth. And in those cases, you're very lucky if you catch it before, but in some unfortunate cases, the tube could burst, and a lot of those end up in a negative situation, yeah? Emergency surgery and the likes. So yes, that is basically what causes tubal pregnancy, yeah. Any other questions on anything that we would have spoken about, yes?
I just want to ask a question on the endometriosis. Yes. Well, my girlfriend, right? When she had during her period, she never experienced pain, but recently, just her 2 cycle gone, she was experiencing pain. But after we discussed it, we were thinking because she now got into the workforce, we were thinking that it could be stress related. So, what advice would you give?
Okay, so in that case, I would not, from my experience and things I've seen, I wouldn't just allude it to stress, especially depending on the intensity of the pain. If it was a high intensity, painful period, that needs to be investigated. Stress, yes, could cause some discomfort, with just generally, you could get a mild headache from stress, but if somebody comes to me and they have a pounding headache where they're getting the pain all behind the eyes and blurry vision, I wouldn't say that is stress. If you understand what I mean, just to give you a comparison, right? So stress, yes, in some cases can cause mild symptoms, but if she has intense pain, then no, I wouldn't assume it's stress, and I would investigate it. First line investigation will be an abdominal or pelvic ultrasound. Yeah? You had some questions on menopause, or? Okay.
Yeah, question. How do we have a balanced diet if we are eating every day? Do we get a balanced diet if we eating every day? That is the question.
Okay, so a balanced diet is more so about what we eat than about how frequently we eat. Because if you eat KFC Monday, Wednesday, Friday, and you don't eat anything Tuesday and Thursday, that doesn't mean that you have a balanced diet, right? So it's not about how frequently you eat, more so than about what you eat, the content of what you eat. So,
KFC, right? We have to get a balanced diet every day. That's what you said, right?
Right, yes, but what I'm saying is that a balanced diet is about what you eat. So you want to have fruits every day. You want to have vegetables every day. It's important to have some form of protein every day, right? So what I mean is about what you eat. That is what balance means. The content, right, more so than the frequency. Yeah. Okay, so as I close, I just want to remind us that even though as women, there are things in our lives to make us feel as though oh gosh, why did God make me? Or, why was it a good idea that God made me? When we think about it, the fact that there are so many positive qualities that we have that can't be found anywhere else. The power that we have within ourselves, right? And even as I said, I mentioned some of these things not to present it in a negative light, but to present it in a light of information and the ability to take care of ourselves, right? God made us special, He made us unique, and even in the times where we might feel the most down and depressed, I want us to think about the fact that God made us in His image. As our sister said here, He made us with a purpose. We are one of a kind, valuable being, right? And He's proud of who He made us to be. Psalm 139, 13 to 14 says, "For you formed my inward parts, you knitted me together in my mother's womb. I praise you, for I am fearfully and wonderfully made." And you are basically saying to Him, Lord, I know that your works are wonderful, and I accept that. Yes? So as we close today, I want us to remember that we are fearfully and wonderfully made, and we know that God's works are wonderful, and we accept that we are part of that wonderful work. Yes? Thank you very much. We have one question here.
Yes, if you have a hernia and you don't want to take operation, which is the best way to treat it?
What type of hernia? You have different types of hernias.
Groin hernia.
Okay, so for hernias in your groin, usually those are treated if they're causing problems. You don't just treat it just like that, right? And if it gets to the point where it's causing problems, then it needs to be surgically treated, and let me explain why. Now, what a hernia is, all of us, we have muscles and stuff in our groin area, right? Now, sometimes it's the same thing as a hernia in your belly. Sometimes, like, there's a little opening, and you have the contents below pushing through that opening. Now, when a hernia starts to cause problems is when what is pushing through gets caught in the space, and then here is getting no blood supply, and it starts to die. So usually in those cases, when you're getting very bad pain, some people get vomiting and that kind of thing. And in those cases, that has to be surgically treated. However, if it's just a hernia, because some persons, their gap is wide enough where the contents will come in and out with no problems all the time, right? Then that is fine. It kind of suppresses sometimes on its own. What you can do, some persons actually push theirs down, but the reality is that the space will always be there. So most hernias that, especially when they start to cause problems, have to be treated surgically because of the detriment it can cause to you. Yeah? Yes?
Is hernia and appendix the same thing?
No, it's not the same thing. Your appendix is actually an organ in your body. It's like a little attachment to part of your bowel, but your appendix, yes, is an attachment to your bowel, but the hernia is not a normal part of your anatomy. That's something that's abnormal, that comes about due to a defect in your muscle. So it's different. Yeah. Okay, so I thank you so much for your attention and your cooperation in discussing with me. I hope it was educational, and I hope that the information would be able to be shared with persons you may know. Thank you again for having me. Okay.
No. Okay, Dr. Clement Marshall, right order, right? We want to thank you very much for coming all the way. It's Marabella you came from to present to us today and remind us why we were made and that we were fearfully and wonderfully made, and to just give us some insight of some of the problems we can have in our reproductive tract. So Thank you very much again. And safe trip home. Okay, so we're going to pick up offering now. Okay, it's that time again. Right, so could I have two young ones get baskets and... Sure. Feel free. Okay, so we can... How many? Okay.
Hold it. I like the blue. Yeah. So nice.
Love is something that you give it away. You give it away. You give it away. Love is something that you give it away. And it comes right back to you. It's just a widow's money. You put it in your pocket and you toss it. It comes right back to you. Peace is something that you give it away. You give it away. You give it away. Peace is something that you give it away. And it comes right back to you. The finisher. You put it in your pocket and you don't have it. But if you share it or you give it away, it comes right back to you.
Bow your heads for prayer, please, on your friend. Dear God and Heavenly Father, we want to thank you for blessing us this afternoon. We want to ask that you bless the offering, be with us, be with those who gave and those who couldn't give. It's my prayer in Jesus' name. Amen. You have to call for him.
Okay, before I give the vote of thanks, I would like to ask, are there any announcements for next Sabbath? Anybody has any announcements? Okay, so the exercise for this evening will be postponed. All right, so for those of you who are raring to go, I apologize. We will postpone it at a later date, and you all will hear about it during the announcements, or we'll put it up on the board. Okay? So this brings us to the end of our 2-day health weekend. My health, my wealth, by divine design. And from yesterday night until tonight, we have gone through a number of topics. And I know that we have all learned something new. And hopefully we go away with this information and we apply it to our lives. Yeah? And even if we know a friend or family member who may be having symptoms or signs that were mentioned today or even yesterday, we could give them the advice to go check yourself out. Or even for ourselves, because our health is our greatest wealth. So I want to thank every one of you who came out from yesterday, even into today, to support this program. And I want to thank especially the presenters. Well, we only have one now, but thank you very much for coming out and giving us some of the knowledge that you have, sharing it with us. And I just hope that as we go through this week, we start implementing some of the things that we have learned. Yeah? Like eating bread that is 2 days old instead of eating it when it's fresh. That will take some work on my part. That was some advice we got last night, that yeast is living and you should eat bread that was made with yeast 2 days after it's baked. And that apple cider vinegar was not as healthy as we thought it was. Yeah. So, yeah. So, I want to thank you very much again. And we are into another week. And I just pray that we all have a wonderful week. And we will see you again next Sabbath. So I will put over to the head of our health section.
Thank you so much, Dr. Roxanne Charles. Henry, it is a pleasure just working along with this team, and the fact that we were able to come together from what the responses we have been hearing from you, that persons have been blessed, their eyes have been opened, they've learned something new. We are grateful to God. And so we just want to remind each one of us that health is a blessing of which few appreciate the value. Yet, upon it, the efficiency of our mental and physical powers largely depends. Our impulses and passions have their seat in the body, and it must be kept in the best condition physically and under the most spiritual influences in order that our talents may be put to the highest use. And so I would like to especially thank, even though they may not all be here, the other members of the health team. And so we have Sister Keishel Strawn, Sister Joanna Bristol, Dr. Roxanne Charles, and I'm your humble servant, Dr. Celeste Henry Buckmeyer. So could we all stand and pray to close? Dear Heavenly Father, I thank you and I praise you for being our Lord, for creating us with such uniqueness and such beauty. Thank you, Lord, for being so intimately interested in us that you care about what we eat and what we do with our time and what we focus our minds on. Use us, dear Father, for your glory. Work in us so that we will submit our will to your will so that we will have improved health. And thank you for just waking us up another day, blessing us, protecting us to live another day, so that we have another opportunity to live in hope and to share you with others. Continue to be with each one of us as we leave from here, but we never depart from you. In the name of Jesus, amen. Have a fantastic week, everyone.